Hello again, and welcome to Occupation Station. I'm Diane Donato, and our guest today, Dr. Sema Hart. She's an associate professor of clinical pediatrics at the Department of Pediatrics at the University of Rochester Medical Center.
Thanks for having me.
Tell us a little bit about a typical day on the job.
I'm a pediatrician, but I'm a hospitalist, so I just work in the hospital. I'm salaried by the hospital. I am on the birth center, which is well newborn, so it's not the neonatal intensive care unit. My job is to examine a newborn and be sure that all the criteria for New York State have been met. I teach the mothers and the fathers, caregivers, how to care for the baby. We do breastfeeding and diaper changes and safe sleep. And I also teach medical students and residents the art of the normal newborn.
So you spend some time both in the classroom and you spend some time with parents and babies every day.
Oh, no. It's all hands-on. So the medical students are in their clinicals, and they're on the floors with me on the birth center. They shadow me. They are learning the art of the normal newborn, and then towards the end, they're with me for 1 week, and then towards the end of the week, they act a little bit more independently and write a history and physical, and then I go through it with them. And the residents are post-medical school, so they're already doctors, and residents are in training for pediatrics specifically. So I need to teach them how to care for the normal newborn as part of their 3-year residency.
What attracted you to this position?
So it took me about 7 years. When I first got out of residency, I went into a private practice that covered a hospital that did exactly this. The hospital was a level 2 nursery. That means that you have normal newborns, but you also have just a little bit sick newborns. Maybe they need a little oxygen or some IV fluids or some phototherapy or antibiotics. And our practice covered the hospital as a separate entity. The more I did it, the more I enjoyed it, and it just kind of swung over that 7-year period where I worked less and less in private practice and more in the hospital setting.
And there's really nothing, I would think, more precious than working with babies, nor anything that takes more responsibility and knowledge.
It is one of the most satisfying jobs that I can think of. I always say it's the happy part of the hospital, but it is truly a joy and a pleasure to see, the face of the caregivers looking at their baby and caring for their baby and asking questions about their baby.
Following up on that, what are some of the things that really excite you about your work?
I love when a mother kind of asks my advice and then takes it. That is very, very exciting for me. I enjoy that so much because she actually, wants to do the right thing. And we have a lot of young mothers and stressed mothers. About 30% of my practice is lower income families. That's another thing that excites me, is to be able to help them get resources that they need to care for their new baby.
Tell us, if you would, a little bit about the rigors of your ACPHS education, your student rotations. How did that help prepare you for medical school?
Well, it's funny. We were just talking about this. Somebody asked me if the pharmacology section of medical school was easier because I had been through pharmacy school, and it was absolutely the case. So in my medical school, I basically helped other students in my class. I did the note service and kind of organized people and did a little, extra teaching or helping, because I already knew when you go to medical school, you have to learn the names of the drugs, and then you have to learn the pharmacology. Well, I already, had that background, so it was immensely helpful.
Dr. Hart, tell us a little bit about your career journey, too, and how you went on further for more education.
Right out of high school, I went to pharmacy school. It was a 5-year program way, way back then. In the middle of my pharmacy education, I got very excited about doing medicine, but I didn't want to quit pharmacy, and I wanted that base. So I finished and graduated from pharmacy school. then before I got into medical school, I actually worked as a pharmacist. I worked in retail, and I also worked, after I became a pharmacist, I worked in the hospital pharmacies of every hospital that I was in doing my medical student rotation. So it was an unbelievable degree to have throughout my training.
And we're going to ask you about research opportunities, the importance of those in just a moment. First, though, we'll take a break. We'll have a quick word from Albany College of Pharmacy and Health Sciences President, Dr. Dewey.
Hi, Greg Dewey. I'm the president of Albany College of Pharmacy and Health Sciences. Pharmacists, they can do so much more than they are doing. They are trained well beyond their practice. And it's become even more important because of the decline in our primary care. Roughly a third of our primary care physicians are going to retire. They're in their 60s, and they are not going to be replaced. And so who's going to replace them? It's going to be nurse practitioners, it's going to be physician assistants, and it's going to be pharmacists. And pharmacists have the training to do much, much more. It wasn't too many years ago, you would never dream of a pharmacist immunizing, getting a flu shot from a pharmacist. And now it's second nature. The world is getting complicated too, and pharmacists understand the complexity. If you go into a nursing home, chances are the average person could be on anywhere from 20 to 30 medications. If you just think about the complexity of that, just the process of figuring out which to take when is a daunting process. You know, a doctor will take one semester of pharmacology in medical school. Pharmacists take 4 years. There's a lot going on. There's a lot of advances in science that are pushing the frontier. Pharmacists, I'm very big on the profession. I call it the central health science. There is nothing in the practice of medicine that doesn't involve pharmacy.
And we return now with Dr. Hart. We'd like to know a little bit more about research opportunities. You work with young people all the time and students. How critical are research opportunities for students who are pursuing a medical degree or a research career?
Yeah, so the institution where I'm currently employed is very big component is research. I personally don't do that much research. The majority of my job is clinical training and teaching, but the research that's available is almost endless. You know, there's so much of medicine and of newborns that's untapped that there's a huge opportunity for people to basically study many different entities.
And what about hands-on opportunities? Could you talk a little bit about the importance of students getting out in the field?
I've been doing this about 22 years, and the change that I've seen has been a little disturbing to me because the students these days are very into the computer and their cell phones. And, for example, I'll ask, have you ever heard grunting? Oh, I heard it on the computer. So I am really encouraging them to shadow me at the bedside and touch the patient and learn how to auscultate and learn how to appreciate different clinical findings. So I think it's vastly important.
We're living in an interesting time where we have access to all of this information and computers which can do wonderful things, and yet it all comes down to it's a human touch.
Absolutely. And like I said, I think it's diminishing where I think people are losing, so that's why I'm really trying to stress the importance of the physical exam with my students and my residents.
Dr. Hart, what are some other things that you think are important for potential students to know about getting into the field of medicine?
So I think I think people need to realize that it's not easy. So not the schooling, but the actual job. There might be a perception that it's high paying and high prestige, but in reality, medicine currently is a lot of hard work, a lot of hours, especially in a teaching institution. The pay is definitely lower than pediatrics as a whole is definitely lower than, say, for example, dermatology or plastic surgery. I think that people need to be aware that you need to want to go into medicine for the reason of trying to offer and help other people that are less fortunate, or trying to use your detective brain to, figure out different diseases that may not give you the monetary support that you had been thinking. But it's a rough road that if you don't want to do it, probably not a good idea.
But if you're called to it, if you are inspired by it, if you find it meaningful.
Absolutely. I can't think of anything else I would want to do with my life. It's very rewarding and very satisfying.
Dr. Hart, looking back and looking at how things are now, do you see a change in how accessible a career in medicine is for women?
I do. I've seen it where, the whole attitude. I work with Dr. Ruth Lawrence, who's been doing this probably almost 60 years, and she had 9 children and breastfed all of them. But this was in the day when, she worked 20, she was a resident, and that word means you live in the hospital. She's superwoman to me. I could never personally do what she did. So now it's much more accepted for female doctors to work part-time and have a family, and people don't expect, okay, when I go see the doctor, if my child's sick, I'm not always going to see my doctor. So yes, I think the attitude has definitely changed and made it a little more accommodating for females.
That's good to know, and I'm sure the medical community is also better for it. While it does represent a change, it also brought in a whole new perspective.
Yes, absolutely.
Well, we appreciate you spending some time with us today to help students learn more about the fields and the potentials that they may be able to experience at some point in the future. We've been talking with Dr. Sema Hart. She's an associate professor of clinical pediatrics at the Department of Pediatrics at the University of Rochester Medical Center. Thank you so much for joining us today.
Thank you, Diane.
For more information or to schedule a tour, visit acphs.edu. You can tune into all of our informative stories at acphs.edu/podcast. Each podcast is also available on Apple iTunes, Google Play, Stitcher, and Spotify, giving you an opportunity to listen from a mobile device. Mark Occupation Station as a favorite, and you'll receive push notifications as soon as we publish something new. Thanks for listening.